I'm Dr. Rob Wilke from Plastic Surgery. I wanted to answer some questions regarding facelift procedures. There often seems to be a number of misconceptions regarding facelifts, and I'm hoping that I can clear some of those up. Facelifts are actually one of my favorite procedures to perform. For the right candidate, we can create a younger, healthy, and more rejuvenated appearance. I really love being able to help my patients achieve those goals. When I see a patient for a facelift consult, the first thing they'll often say is that the reason they want the surgery is that when they look in the mirror, they don't feel like they're seeing their real self anymore. They're looking older than they feel. The next thing I'll most commonly hear is, I don't want to look unnatural. I don't want to look like I'm in a wind tunnel. We've all seen people that have had facelifts where there are obvious telltale signs that they had a facelift. They look pulled and tight and don't have a natural appearance. This is not the kind of result that we want to achieve at plastic surgery. A result that doesn't look natural is not a success. We want to achieve that younger, healthy, rejuvenated appearance, but still maintain a very natural look, not an appearance that looks like someone has had surgery. So how can we accomplish that? First of all, if we look at a young face compared to an older face, what do we see? We'll note that in a young face, the volume is higher compared to an older face. As we age, the natural fat pads of our face settle downward, creating too much volume in our lower face, and often a lack of volume in our upper or mid face. The skin of a young face is smoother, but it doesn't look tight or pulled, so that's not what we want to do. So surgically, we need to lift the deeper tissues to lift the volume of the face upward, restoring a more youthful shape to the face. The skin is lifted as well to create a smoother appearance, but we don't want to pull or tighten the skin excessively, creating a tight appearance. We're basing the skin lift on the underlying tissues which are lifted, which allows the skin lift to be more gentle and avoids that tight appearance. Where some surgeons fail their patients is they don't adequately lift the deep tissues, or maybe don't even lift them at all. It is a more technically challenging and difficult procedure to lift the deep tissues as opposed to just pulling the skin. So some surgeons may not put enough effort into that part of the surgery. They then try to compensate by overly pulling and tightening the skin, which creates an unnatural appearance. It also doesn't hold up well, as the skin is very elastic and will stretch out again relatively soon. The deeper tissues are relatively not elastic, so they tend to hold their position much better long term. Here are a few pictures to help explain what I'm talking about. This picture is from a study by Dr. Val Lambros in which he took computer images of many people over a period of more than 20 years, then did computer averaging of these pictures. So this picture is a composite average of many people over many years, and it shows how the volume from the upper cheek drops into the lower cheek and face, causing fullness in the nasolabial folds and jowls, and a relative loss of volume in the central and upper cheek. This picture also shows that progressive change in facial volume and contour. The front picture is a young face, the middle picture a more middle-aged face, and the back picture an aged face. And again, we see how the volume gradually drops out of the upper and central cheek and settles into the lower face. This picture shows where the incision is located for a standard facelift. It's well hidden along the hairline and within the contours of the ear. This picture shows how once the skin is elevated during a facelift, we can then lift the deeper tissues of the face. In the cheek, we lift what's called the SMAS, and in the neck, we lift what's called the platysma. So those are the basics of how we do a standard facelift at plastic surgery and how we can achieve a natural rejuvenated result. The surgery is done under a general anesthesia in our on-site surgery center. Patients generally can go home with a family member the same day. We do a post-op check in clinic the next day, and usually a couple more checks over the next 1 to 2 weeks. Most people do have noticeable bruising and swelling for the first 2 weeks. Generally, by 2 weeks, people can begin to get back to a fairly normal level of activity. If you're considering a facelift or any other cosmetic procedure, I encourage you to call Plastic Surgery to set up an appointment with one of us, and we can custom design a plan to help you achieve your goals.